nurses treating patients who have then begged for the vaccine when fighting the virus in the hospital. But by then, it's too late. Making the choice to be vaccinated right now can keep you out of the hospital and, more importantly, out of the obituary pages. However, if you have been exposed to the virus or have symptoms of COVID-19, I want you to know there are many options for you to seek testing. We've heard about how busy our hospitals are, so please don't go to an emergency room simply to confirm a COVID-19 diagnosis. Many pharmacies provide free drive-through testing by appointment, and testing may also be available at doctor's offices, urgent cares, and community health centers. And of course, free rapid testing kits are available at libraries, local health departments, and community health centers across our state. Now, although COVID-19 vaccination remains remarkably effective at preventing severe disease, we know that immunity can wane over time. So with the COVID vaccines, it's important, just as it is with any other vaccine, to stay up to date with your vaccinations. Now, right now, we're going to join O'Reilly Family Pharmacy in Worthington. O'Reilly Pharmacy is one of thousands of locations across Ohio that offer COVID-19 vaccinations, including not only the primary series, but also booster doses. First, we're joined by Giovanni Valentino, who is going to get his booster dose today. So good morning, Mr. Valentino. It's clear that you've already received your initial vaccine series since you're here today to get a booster. What made you decide back then to start your vaccination series, to get that initial vaccination?
Yeah, great to be here. Thanks for having me. It was a personal choice of just wanting to be able to protect, my family, the people that I would run into and encounter with my day-to-day job that I do, and my kids.
Thanks. We're of course approaching the holiday season, and a booster dose can, as I've shared, provide an added layer of protection for you and, frankly, for the people around you. What made you decide to get that booster shot today?
For that exact reason, getting into the family season and seeing, just seeing family, but seeing more elderly family more than anything. Grandparents are in their 90s, and, we're going to be around them and want to make sure that they're going to be protected.
Great. Now, have you gotten the booster already, or are you about to get the booster?
I am about to get the booster.
Okay. Well, you know what? We'll pause and let Dr. O'Reilly give you that shot.
Now roll your sleeve up here. Do you have any questions about the vaccine today?
I do not.
Can you hold it right there now?
Sure.
We're done.
Well, very good. Well, thank you for sharing your experience with us today, Mr. Valentino. In Ohio, more than 2.2 million additional doses have already been administered, either as a booster dose like you just received, or as additional doses for people who are immunocompromised. Booster shots, let's remember, are recommended for the Pfizer and Moderna vaccines at least 6 months after completion of your primary series, and for those who got J&J, 2 months after completion of that shot. Pfizer recipients must be at least 16 years old to get a booster. Booster doses are crucial, not only because of the protection that they provide against Delta, which is the dominant strain driving these incredibly high hospital cases that we're seeing right now, but also because early research points to timely boosters providing protection against severe illness and death, even from the new Omicron variant, which is on the way. So for people who received their initial series 6 months ago, you have to recognize that you might now have diminished levels of those neutralizing antibodies as we're getting ready to face Omicron. However, receiving a timely booster dose now, if you're eligible, has been shown to restore those antibody levels and will provide significant protection. Well, today we're also joined by Amy O'Reilly with O'Reilly Family Pharmacy, who just finished giving Mr. Valentino his shot. To learn more about why so many Ohioans are rolling up their sleeves, we're going to ask her for her frontline perspective. So good morning, and thanks for joining us. So can you tell us what are some of the trends you're seeing in vaccinations, and what are some of the Ohioans who are coming in to see you saying about their boosters?
Good morning. Thanks for having me. We've seen a definite uptick in vaccinations over the last several weeks, and especially in boosters, but we've also positively seen some primary doses too, which always makes me excited. As far as boosters, we've seen a lot of people that really want to help protect their families and protect their communities and keep themselves safe during this holiday season. And I think that, it's a great way to kind of keep everyone healthy during the holidays and as we move forward through this.
Well, thank you very much. One other question before we move on. What are you hearing from folks in terms of the boosters and the holidays? Are people looking at the boosters a little differently now that we're approaching the holidays?
Yeah, I think everyone's favorite question is, what are the side effects going to look like? Am I going to feel sick over the holidays? And, kind of my experience, and we've probably given close to 5,000 boosters now. So our experience has been, you might have some side effects, but they're usually pretty mild. They tend to last about 12 to 24 hours. A sore arm, headache, and some, what I tell people, because I got mine on Monday, I was a little foggy feeling, just not quite 100%, but I worked all day. I was fine to be out and about, and that kind of resolved itself within 24 hours. So.
Terrific. Well, thank you so much, Dr. O'Reilly. One question that I and my staff frequently get asked is, if the vaccines are effective at preventing serious illness, COVID, then why do we need boosters? Well, basically, the initial vaccine series is teaching our bodies how to create the appropriate immune response to protect us from serious illness from COVID-19. When you get that initial vaccine series, your immune system is primed to spot the virus and then to produce the right antibodies to defend you against it. However, sometimes over time, that immunity can wane. And booster shots are a way to remind your body's immune system about the virus and to sort of reprime it for peak performance in defending you against the virus. And it really is giving your immune system a boost. Now, remember, COVID-19 vaccines, including the boosters, are designed to protect us from severe illness that results in hospitalization and death, much more than they're designed to completely block even mild illness. So if you end up with a mild or asymptomatic case and you've been vaccinated or boosted, I think you can still rest assured that the vaccine's doing its job. It's providing immunity to keep you out of the hospital or worse. And while some may think of these as breakthrough cases, I like the way Dr. Joe Gastaldo put it last week in saying that he really sees these more mild cases as post-vaccination infections as opposed to breakthroughs. A true breakthrough from a medical perspective is one that results in serious illness in a fully vaccinated individual. So if you get a mild case, but don't develop serious illness, I think you can rest assured your vaccine has protected you as it was designed to do. Now, we're joined by a physician who's been with us before, Dr. Steve Gordon, chair of the Cleveland Clinic's Department of Infectious Disease, to learn a little bit more about our boosters and how they work and why they're needed after some vaccines. Dr. Gordon, thanks for joining us again today.
Thank you so much. It's a pleasure to be here.
Dr. Gordon, boosters for our vaccines are actually not uncommon. COVID-19 vaccines certainly are not the only ones for which additional doses or boosters have been needed. What are some of the other vaccines that require boosters or annual shots, and why is that?
No. So another great question. So, Bruce, to highlight what you said, I mean, boosters have been around for a while. The strict definition is an additional dose after the original primary series, and that's to optimize the vaccine effectiveness against immunity, that's against disease, as well as prolong its durability. So for those of us who remember or have kids or grandkids, it's routine in peds. They get their series of shots before 18 months, and then they're brought back at 4 years, and some of those are boosted, and then some of those are boosted again. And again, those are well worked out by the epi in terms of timing. If we look at adults, probably our most common booster, I would say, is our tetanus shot, right, every 10 years. Other respiratory viruses, influenza, maybe technically not a booster because, as you know, that formulation changes every year in anticipation of the circulating strains. And now when we pivot to COVID, as you mentioned, people are saying, well, are these vaccines effective, or why the boosting? Part of this is we are learning as we move along, and we've learned a lot. And I want to emphasize, as you said in the beginning, new studies have shown that our vaccine program here in the homeland has saved 1.1 million lives. I mean, we mourn for the losses, but 1.1 million lives, and importantly, have prevented 10 million hospitalizations. And that's more important now than ever, as we'll talk about in terms of what's going on in our hospitals. In terms of COVID-19 and the need for boosting, the other thing to remember is, of course, the vaccines were designed for the spike protein, and the viruses have mutated just like influenza. So some of the effectiveness, it's not surprising if there's mutations, that the initial vaccines platforms that were set at the ancestral strain may lose some effectiveness. We saw a little bit of that with Delta. And again, the initial studies with Omicron show the same. But as you mentioned, a lot of that can be recovered with the booster dose. And this is what we have moving forward. And things may change in the future, but this is what we can do. Boost, as indicated, and of course, get your primary vaccine if you haven't. Please consider that. But also recognizing, as you mentioned earlier, boosting is not for everyone. Not everyone is yet eligible for a vaccine. People less than 5. And you also mentioned the people in less than 6 months are not eligible for a vaccine. And for adolescents, it's really the 16 and 17-year-olds, which was just announced last week.
Yeah, thank you so much. So let's turn to that issue of hospitalizations. We're seeing very high levels of hospitalizations all across the state, particularly severe up in the northern half of the state. And, right now, that surge is being driven by Delta and driven predominantly by unvaccinated patients. Can you tell us a little bit of the frontline perspective, share that with us? How is Delta, which is our dominant form right now, impacting our hospitals?
You mentioned some very good things. And right now you mentioned the levels. So here in Northeast Ohio, in our Cleveland Clinic healthcare systems, we now have the highest census inpatient COVID that we've ever had. This goes back to last December, including, as you mentioned, the highest intensive care. That's about 20% or so. Our current bed situation, and this is true with UH and around us, about 33% to 40% of the regular nursing floors beds are occupied by COVID-19. And then ICU, it's up to 50%. And here we obviously do the ECMO, the kind of artificial lung support too, which is extremely advanced. But what I will say is, and I don't want to put coal in people's stocking, but Omicron is here as well. And as you know, your labs identified that first, and it is here. And when we look at our numbers these past weeks, we're seeing increased positivity rates. It's up to about 30 to 40%. And I do anticipate, we've identified, as you have, Omicron, that it is circulating. And I don't know how much that's contributing, but we are preparing for a potentially respiratory viral, what we call tidal wave. And I say that because we're moving into holiday season, Christmas. If you looked, and I checked at the TSA throughput today, it's about 1.5 million, which is 3 times what it was last year. And at Thanksgiving, that's going to go up higher. It's cold season, so people are moving here in Northeast Ohio and elsewhere closer together. Masking and social distancing, I'm not saying it's not going on, but I think we all realize it's diminished outside of certain areas. And flu season is here, although not revved up, but we're seeing flu in RSV as well that we didn't see last year. And if Omicron truly is here now, and we know that it is, that increased transmissibility is going to stretch the system again, even if disease with Omicron may be less, what we would say, virulent, but the numbers game there, it's a math game. You will get increased people seeking medical attention. And we have not yet, as you said, Bruce, decanted, or we haven't reached the peak of the Delta surge. And so this gets down to operations, which I know you're in conversations with in the zones, the 3 S's. We talk about staff, we talk about stuff, supply chain, and we talk about space. And right now, if we were to assess, I think staff is really the thing that's keeping us up at night. Aside from this is the 4th deployment for a lot of people. I understand they're tired, but also healthcare workers are also going out, or they're having to take care of their own family members. So we are all preparing, hoping for the best, but as you said, preparing for the worst, because it's our goal. We need to be sure that we can take care of the sickest Ohioans in this, what we call crisis of care.
Thanks. Let me turn it for one final question, and it relates to the Omicron variant. I've been reading avidly the scientific literature that's emerging, and there has been some encouraging information about the current boosters and the Omicron variant. Can you tell us a little bit more about boosting and its importance as we anticipate Omicron becoming much more prevalent in Ohio?
Another great question. So our sources of that are evolving, as you said, and we're getting some information, both from South Africa as well as now the UK. In terms of on the clinical field, yes, vaccine effectiveness for the 2-dose is less than the 3-dose, but 2 doses in South Africa is still 70% effective against severe disease and death. It's diminished from the 90%. And again, when we look at some other studies, what we call the in vitro studies, which is taking plasma from people who've been vaccinated. And so the Pfizer data came out showing, again, diminished neutralizing antibodies. So it doesn't always correlate with clinical, but the 3rd dose can elevate those neutralizing antibodies up to about 70% compared to ancestral strains. So we do believe that boosting is one of the tools in the armamentarium as well as primary vaccine. But I would urge our listeners and audience, as we move into, again, respiratory season, there are other reasons to mask other than COVID and gathering, and to do that reassessment as you're getting together with your families. As you mentioned, testing, as you mentioned, making sure that boosting when appropriate, and having those conversations with your family members and your trusted primary providers.
Thank you so much, Steve. Well, as we've shared today, it's critically important to stay up to date with your vaccinations for COVID-19 and to receive your booster dose when you're eligible. Boosters allow our body to fight COVID-19 at the peak of protection, whether it's the dominant Delta variant that we see now or the emerging Omicron variant. Remembering that early research regarding vaccine protection from Omicron are encouraging, particularly in terms of boosters. As you know, we have now detected Omicron in Ohio through genomic sequencing, and will continue to report proportionality of that variant on our variant dashboard, which we update on Mondays. And while there's still a lot to learn about Omicron, it is becoming increasingly clear that Omicron is highly contagious and can spread faster even than Delta has spread. Secondly, the arrival of Omicron underlines the importance of all of us keeping up to date on our vaccinations, including getting boosters. Recent research really suggests that antibody protection from the primary series, as Dr. Gordon outlined, really can fade over time, substantially diminishing our protection from Omicron. On the other hand, the good news is that getting a booster appears to restore those antibody levels. Indeed, the research is showing that those who recently received a booster are demonstrating strong levels of protection against the Omicron variant. So in short, if you're eligible and haven't gotten your booster, now is the time. Omicron's here, and all signs are pointing to it being more contagious. Please protect yourself with a booster if it's due. So as we head into 2 of the busiest holiday weeks of the year, we are urging all Ohioans to pause and think about what steps you can take to stay safe from COVID-19. If you're not vaccinated and you're vulnerable to this deadly virus, if you don't yet have your booster shot, your body may not be at peak protection. And it's simply not too late to start your vaccine series or to get your booster shot if that's needed. In either case, please roll up your sleeves, maybe again, and strengthen your protection. Hospitalizations and deaths from COVID can largely be prevented, and we need to take all the steps we can to keep ourselves safe during the holidays. And I think that Dr. Gordon outlined very well that we need to think about all the steps. We need to think about vaccination, but we also need to think about masking, social distancing, all the things we've been talking about throughout this pandemic. Finally, in this season of giving, if you're able, please consider donating blood. This week, the Association for the Advancement of Blood and Biotherapies, America's Blood Centers, and the American Red Cross are urgently requesting blood donations as the blood supply in the US has reached one of its lowest levels in recent years. Let's remember that blood can be a life-saving gift to someone in need this holiday season. So with that, Michelle, I think we can open up to questions.
Thank you, Dr. Vanderhoff. Our first question is from Joe Ingalls with Ohio Public Radio and Television.
Hi, Joe.
Thank you, doctors, for doing this. I have a question. For the past year, you've begged, cajoled, tried to inform people to get shots and wear masks, and many don't. They run to the hospital when they get sick with it, though. And we know the hospitals are overwhelmed and unvaccinated COVID patients to the point that there are so many who have been vaccinated and are doing the things to try to prevent this that are not getting medical care they need because there's so many COVID patients. Is it fair to turn away sick people who are vaccinated and who have been wearing masks? And should hospitals start thinking about limiting care they provide for unvaccinated COVID patients? Is there any talk of doing anything like that at this point?
Well, thank you for that question. And what I would say is that that is an understandable sentiment, but that healthcare providers and hospitals have never actually taken that approach to people with illness or in need. Our approach has consistently over many, many hundreds of years been one that focuses on meeting people where they are. And our mission and our service is to caring for people to the best of our ability when they come to us. Now, I think you're absolutely right that each of us needs to reflect on our role in protecting not only ourselves, but the people around us and the people that we love and care for. And so all of the messages that we have shared, that the governor has shared, that I and the doctors and other health professionals and patients who have come on these conferences have shared, we continue to share with the public. These are the steps that all of us can take, and they begin with getting vaccinated. The track record for vaccinations is undeniably impressive. They have provided an incredible degree of protection, and they have done it in a very, very safe manner. But there, of course, are many other steps that each of us can and should take. And again, I think Dr. Gordon summarized those very well.
Yeah, Bruce, if I can, the question I think is an interesting one. You know, we don't define our patients by their vaccine status. On the other hand, if you listened, it was last week, to Francis Collins at NIH, the same question is raised that you're raising. Why, for a life-saving therapy, are so many Americans choosing not? And I don't have the answer to that. And I think that needs to be studied. So when I talk to my unvaccinated patients, I ask them why. I'm not trying to judge them, because I need to learn where do we miss out on the messaging. And I think that's an important piece that I think the NIH is looking to study, is behavior in terms of where did we go potentially wrong, or where could we have optimized that message.
Thank you, doctors. Our next question is from Dan DeRoos with WOIO.
Good afternoon, doctors. Certainly appreciate the time today. Dr. Vanderhoff, I'd like to ask this question. If you don't have the data, I'd like to ask a different question. Do we have more data on exactly how many Omicron cases at this point? Obviously, Delta is much more important to focus on, but obviously the Wexner Medical Center said 2. We've got 1 from the Cleveland Clinic, Tuscarawas Health County, now Health Department saying they have 1. Do you have a handle on how many numbers? And if you don't have that data, I'd like to ask a different question.
Well, I can answer it to a degree. We of course, have very small numbers that are showing up, but they're showing up in various geographies in the state. And as we look at the experience in other parts of the country and other parts of the world, the doubling time, or the rate at which this version of the virus, the Omicron variant, has expanded or spread has been very rapid. Some have talked about doubling times of as short as 2 days. And we know from those geographies that as soon as it appears, it is clear that there are many, many other cases out there that are just not yet detected. So I think we have to make the assumption that Omicron is on the scene, that we are going to see more and more of Omicron in our detections, and that it is going to drive more and more cases of COVID-19. There are many other variables we can't answer definitively yet, including questions about the proportion of patients who will end up very sick from Omicron. Early indicators are, and including as recently as reports this week out of South Africa and their largest insurer, who was able to look at data there and seems to confirm, even when controlling for vaccination, that Omicron causes fewer hospitalizations and deaths, but it's still too early to know what its impact will be. But I'll say this: anytime you have a form of the virus that's spreading rapidly to many people, even if it's proportionately less severe, you have more numbers. That creates a very real risk of compounding an already serious situation in terms of pressure on our hospitals. I'll turn it to my colleagues. Dr. Gordon, this information about Omicron is certainly in your wheelhouse.
No, so thanks for the question. Yeah, we do. I mean, there is a rapid screening test that can be done. It's kind of a poor man's sequencing, because that data does lag, as Dr. Vanderhoff said. If you look at the CDC data, even if you look in the New York area, right, for the past 3 weeks, it's gone from less than 1% to 3% to now 13%. And then look at the UK. For this week, UK, it is now the predominant isolate. It pushed out Delta. And if you look historically, the US lags behind the UK probably about 4 to 6 weeks. So new CDC modeling, which I'm not certain took all in account, Omicron, is estimating that by the end of this year, right, that we now are at about 750,000 cases a day, moving up to 1 million. But I do believe you will see much more reporting in Dr. Vanderhoff. The next briefing, you'll see that Omicron is here and successfully, obviously, being transmitted in the community.
Thank you, doctors. Our next question is from Laura Hancock with The Plain Dealer in Cleveland.com.
Hello. This morning, the governor announced he is quarantining at home because he and the first lady were exposed. Are we reaching the point where you guys coming out here once a week, pleading for people to do the right thing is enough?
Well, so let me answer that question in the following way. First of all, I think that one thing that we're seeing is that once again, as he's done throughout the course of this pandemic, the governor's leading by example. And so you see that he became aware of a potential contact, and he has taken decisive action to put himself into quarantine and show that that he is doing exactly what we're asking everyone to do who unfortunately might have a contact. The second part of that, though, is that as we see this virus becoming more and more contagious, its ability to spread and its ability to place people at risk really just becomes that much more severe. And more and more and more of us are going to inevitably encounter this virus. I think it just simply underlines how important it is for all of us to take the appropriate steps. Personal responsibility is a very important part of making any community, any society work really, really well. And the question that you're asking really points to the issue of personal responsibility and how do we take the steps that we can take to protect ourselves and each other. And for some people, there may be reasons they can't receive the vaccine, but there are other steps that we can all take regardless. And I think Dr. Gordon pointed to the fact that simple observation out in public would suggest that there's more all of us can do in addition to choosing to get vaccinated. We can be more mindful of the environments that we're in. Is an environment more crowded than it's safe for us to be in? Are we wearing a mask where perhaps we should? What about those holiday gatherings? Is this perhaps not the year to have the extended family, including vulnerable members of our family, gathering in one place with the degree of spread that's going on? So a lot for each of us to consider.
Thank you. Our next question is from John London with WLWT.
Thank you all for doing this. I was struck by the situation Dr. Gordon described up in northeastern Ohio, and it's reminiscent of what UC Health CEO Dr. Lofgren said yesterday here, that our hospitals in this area, they're seeing alarming rates. So I wonder to both of you, what more can be done, do you think, to combat staff shortages at Ohio hospitals, or is this kind of a hang on by our fingernails over a cliff time for Ohio hospitals?
Thanks for that question. I think it's an excellent one. And what I can tell you is that the Ohio Department of Health, the governor, hospitals across our state have not been idle in terms of addressing this and looking. We have been very actively behind the scenes working through our zone structure to shift resources to, at each step in the path, address the situation and assure that there are healthcare resources available to people when they need them. Inevitably, in these situations, though, we do have to make adjustments and accommodations. And you're absolutely right that it is not business as usual in our hospitals. So many of them have had to discontinue or pause delivering elective procedures. And as we've said before, while those are procedures that can be safely delayed, they're still very important procedures to the people who are waiting to get them. And there are countless other steps that we are taking, different approaches to triage in many of our emergency rooms. They ask that I voiced today and that we've heard from others about, please don't turn to your emergency room for routine testing for COVID-19. There are countless other resources that you can undertake, and there will be responses to follow. So, what I would say is this is a day-by-day, hour-by-hour situation. We are all working actively and closely together, and you can rest assured that we will continue to work together to use the resources available to us for the benefit of people across the state.
Our next question is from Roosevelt Leftw with WJW TV.
It's good morning, everyone. Thanks for having this right now. Can you give us an idea here? You mentioned the importance of boosters right at the beginning of this and just how, getting that booster gives you that extra bit of protection. Can you help? I guess a lot of folks still have a little bit of cloudiness about what booster to get, how they should get it. If you've got Moderna, can you get Pfizer? If you've got Pfizer, can you get Johnson & Johnson? What can you clear up this a little bit here? Because that's one of the big questions we're getting from a lot of people about what should I get in addition to where should I get it?
Yes, happy to do so. I'll begin and then maybe turn to both of my colleagues, both from a pharmacy and from a infectious disease perspective. The challenge in having many options is that having those many options can create some confusion. And I think that the messaging around this, especially in the fall, was in fact a little confusing. A lot of that has been simplified now. And the good news is that regardless of which vaccine you started off with, when you are ready for a booster, you're actually eligible to get whichever booster you're most comfortable with, or perhaps even find most readily available. So the good news is you don't have to stick with, let's say you began with Pfizer and you want to get Moderna for your next shot, you're able to do that. So that part has been simplified. We have also largely simplified the age brackets. Basically, all adults are eligible for vaccines, and the time issue for Moderna and Pfizer is the same. It's 6 months. They're both mRNA vaccines, whereas for the J&J vaccine, that time's a little bit shorter. So let me turn first to a pharmacist, Dr. O'Reilly, to share a little bit about boosting and how she helps educate people about boosting. And then I'll see if Dr. Gordon has anything to add. Dr. O'Reilly?
Yeah. So this is a question that we get every day in the pharmacy. So first of all, where to get your boosters. Any of your local pharmacies should have them available for you. We're doing them on a walk-in basis, but I know there are appointments available at all of the major stores around as well. And then, as for which combination is best or how does that work, the best booster is whichever one is available to you when you're ready to get it. So we just highly recommend that you get your booster when you're eligible. As far as the combinations, I think I can safely say I have done every combination possible at this point. All of my patients have received benefit from getting a booster, regardless of which combo they got. So, just go ahead and get that when you're eligible.
Dr. Gordon, anything that we missed?
No, that's beautiful. I would just say that we would now consider J&J to be a 2-dose regimen, whether that second dose is another J&J or an mRNA. So that's the other change. And then the only other exception would be the immunocompromised patients. It's going to be at least 3 doses is a complete dose. So a little bit of nuances there, but thank you so much, Dr. Riley. And you administered that vaccine so well.
Thank you.
Thank you, doctors. Our next question is from Lindsay Mills with 10 TV.
Hi, good morning. My question is about the backlog that we learned of this week. When those manual reporting errors happen, what is then done to address it to make sure the information is as accurate as possible going forward?
Yeah, thank you. That's a great question. This has actually happened before over the course of the pandemic, so this isn't the first time that it's happened. But inevitably, there can be glitches in the electronic reporting that goes from a laboratory, perhaps where the testing is being done, and then porting over electronically to the ODH reporting system. That's essentially what happened this time. Once those are caught, they're carefully reviewed, identified, and then put into the system. And there's a difference between we add them to the overall report kind of in a bolus, but rest assured that each one of those cases is specifically linked to the date when it was actually reported out from that lab in our overall system. So there's no problem or interference in terms of retrospective look and understanding on a particular day exactly how many reports were recorded. That's all recorded properly because we go back and do this by hand. But essentially, this is inevitable. There are going to be times when a given computer system with a given lab, either due to an update or some other glitch, just fails to automatically port that out. People find that very quickly, and then we work to make sure it gets added to the overall reports. So that's it in a nutshell.
Thank you, Dr. Vanderhoff. Our next question is from Courtney Francisco with WCPO.
Hi, do you think the number of cases is underreported due to at-home test kits that don't get submitted to the database?
Well, I think throughout the pandemic, that's been a possibility. I don't think we're likely seeing proportionately any more of that now than we were seeing before, recognizing that Ohio has really been on a per capita level, one of the leaders in the nation in delivering access to these at-home tests. So I think they've been very, very important. But actually, a large number of the ones out there, including the ones that are provided in many instances by the state, are proctored. And so those, through that proctoring process, automatically get entered. And one might also presume that we are just as likely to get negatives that are performed out there and don't, show up in systems either. So, yeah, I think there's undoubtedly some of that, but the benefit or the value of people getting the information they need to make good healthcare decisions, I think outweighs the modest risk that we're not able to count each and every case that occurs.
Thank you, Dr. Vanderhoff. Our next question is from Max Filby with the Columbus Dispatch.
Yeah, thank you all for doing this today, doctors. The CDC put out a recent projection that was looking pretty grim for January. So I'm curious, is there anything you want to tell readers, about why they should pay attention to that and what they should do in the coming weeks so we can try to avoid that? Thanks.
Yeah, thanks for that question. If you look at projections for the United States, or you actually look at the learned experience from other parts of the world, they all point in the same direction. And that is that Omicron is emerging on the world scene and is certainly emerging here in Ohio, as we shared. And it's coming even as we are dealing with a Delta-driven surge, which is greater than any surge we have seen before. So all one has to do is look at that and say, we're facing very serious situation in terms of dealing with COVID-19. And then when we add the layer onto that nearly all, not all, but nearly all, the vast majority of the people who get sick enough to require hospitalization or, God forbid, pass away from COVID-19 are people who are unvaccinated or have not gotten a booster on time. And it really just points to the message that we're sharing here today and why it's so important. It's the reason that you see healthcare providers in front of you expressing with urgency the importance of getting your vaccination or getting your booster, keeping your vaccine status up to date. Let me turn to my colleagues and just see, if you'd add anything to that.
No, Dr. Vanderhoff, I think it's there. I think we're hoping that there won't be this tidal wave, but we anticipate that will happen. If there may be a silver whatever cloud behind this storm, it's possible that Omicron will deliver immunity very quickly And it will find the non-immune very quickly as well. And hopefully in people who have been vaccinated or have had prior infection won't develop severe disease. But hope, as we said, is not a plan. And so all of us are concerned about now hospital capacities, as Dr. Vanderhoff said, Omicron or not, in terms of getting us through this tight period so we can deliver essential healthcare services, COVID and not COVID, to the citizens of our counties and states that they anticipate.
Thank you, doctors. Our next question is from Jackie Orozco with ABC6.
Thank you. Just one quick question. Our viewers want to know, when will the pandemic be over? If we are constantly getting new variants, does that mean we have to get more boosters and new vaccines? Will it be enough to live a pre-pandemic life again, like what we used to do during the seasonal flu?
Well, thanks for that question, because I think it's a question each and every one of us asks ourselves and thinks about. And more, I think over the period of the past months, I think you've heard healthcare providers and experts in epidemiology looking at this virus and saying, you know what? What we have to learn to do is to live with this virus. It's just not going to be possible at this stage in the game to eliminate this virus. So how do we live with this virus? And the messages we've been sharing today are the key to living with this virus. And while we are all very grateful that about 70% of the adult population has gotten vaccinated, and we're really grateful to see how many young people are getting vaccinated, we have more work to do because, of course, just like some of the vaccines that Dr. Gordon shared with us that require boosters and are part of keeping our children healthy, the vaccines for COVID-19 require boosters that all of us need to stay up to date with if we are to keep ourselves and our communities healthy. And there's just more work to be done there. Now, there are lots of variables here, and Dr. Gordon pointed to one. It is possible that Omicron will be associated with less severe disease and will be a mechanism for expanding immunity in our communities and potentially help actually pull us out of this. But that's a hope. And I think that we have to look at reality that we're facing right now and anticipate the very real possibility that this actually could exacerbate an already serious problem on the ground that's being driven by Delta. And the advent of Omicron just has a lot of unknowns with it. So I understand how people feel. Believe me, each and every one of your panelists here today feels very much the same. But we can't we can't throw our arms up. We've got tools. We need to put those tools to work, and we will get through this. But now's not the time to let up on the gas pedal. Let me turn to my colleagues. Anything additional that you might add?
No, Dr. Vanderhoff, I think you hit it. I mean, I think we have to remember that of the seasonal coronaviruses, there are some that probably caused pandemics in the past as well. And I do believe, that we will reach equipoise, probably after we learn more about Omicron. Some of the subsets we're looking at, look at the highly vaccinated, healthy people like the college kids that are surveyed. We're going to get a lot of information about that. And for most of them, it might turn into the cold or just that inconvenience that Dr. Vanderhoff talked about, not so much breakthrough, but post-vaccine prevention. And that's a win. And that is, I think, where we're moving toward. The challenge is I do believe there's still a lot of patients out there without immunity, not vaccinated, who are at high risk for severe disease. And we want to prevent those hospitalizations and deaths. But as stated, we're going to know a lot more, I think, in first quarter. The other thing I'll say is therapeutics are coming. And that's the other beautiful thing about getting people to do their own testing, because some of the therapeutics, if they're going to be approved, are going to be dependent on timely testing that you don't want to make an appointment to see me. You want to be able to do that test at home and then boom, get the oral antiviral. So I think that's a positive as well.
Yeah, I think it's just important we all know someone that's not vaccinated at this point, and just to continue to have those conversations with people that vaccines are safe, that they're effective, that getting your boosters, all of those things are going to help us move through this.
Thank you. Our next question is from Pete Grieve with Spectrum News.
Hi, I'm wondering if the Ohio Department of Health has been involved in any conversations with the Ohio National Guard about ways in which Guard members might be able to support our strained hospitals during this surge.
Well, we maintain an active dialogue with the Guard and all state resources as we have moved through the pandemic. And, part of the analysis that goes on there is how can we best address the problem? One of the things we don't want to do is move Ohio resources from a community that desperately needs them out of that community and into a community that also desperately needs them, because then we're disadvantaging one community to help another. But we're actively engaged with them. And I think that that is on a daily basis. So rest assured, that's part of the calculus and the dialogue. And if and when we see an appropriate opportunity, that will be something that we will do.
Thank you, Dr. Vanderhoff. Our final question of the day is from Andrew Welsh-Huggins with the Associated Press.
Hi, everyone. Thanks so much for doing this. Is Mr. Valentino by any chance still on this call, the gentleman who received the booster?
No, he had to leave.
Well, in that case, I'd like to pose a question to Dr. O'Reilly, and it's sort of just based on your experience as a person on the front lines. Essentially, 9 days before Christmas, what is the mood of the people that you're working with as they come in for shots or boosters? I mean, this is our second holiday season going through this. Are you seeing resignation, pessimism? Is there anything to be optimistic about as we look at several more months of this? And I guess that question would be both what you're hearing from your patients and frankly, how you're feeling.
I think for me and my staff, every person that comes in and gets a booster is a positive for us. It's one more person that we're protecting within our community, and it's more people that we know are being safe and protecting their loved ones. There's always some exhaustion. We've done a lot of shots over the last year. But the positive side of it is that those shots are all people that, we can protect, and it's our way of contributing to the community and to, the pandemic resolution. The more people that we can vaccinate, the less people we'll hopefully see in hospitals. And so, some days it's a lot, but it's also a great feeling to know that at the end of the day, we're keeping our community safe.
Thank you, Doctor. That was our final question for today. Dr. Vanderhoff, do you have any closing remarks?
Well, thank you to my guests for joining us, and to Mr. Valentino, who I know had to run, but we're very grateful for him generously sharing his booster experience with us. Thank you to all of you for your continued interest in COVID-19 and its impact on our state, and the messages that we're wanting to share with all Ohioans.
Thank you. This concludes today's press conference. Thank you again for joining us today.